It's time now for Back on Track with your host, Wardel Williams, your home for a healthy mind, healthy body, and healthy soul. Now your host, Wardel Williams.
Good morning, Kansas City. I can do all things through Christ that strengthens me. We want to welcome you to the Back on Track with Wardel. I am your host, Wardel Williams, and I thank you for being here. We are here to talk about a healthy mind, a healthy body, and a healthy soul. Want to give a shout out to Bishop James Lewis of the Church of Christ Pentecostal Church, Pastor Ernest Greenlee, Mount Tabor Baptist Church, and Pastor Modest Miles of the Morning Star Baptist Church. Also, Pastor Harrison Jackson and Pastor Price Ellis of the Cleveland Avenue Baptist Church, along with my good friend, Pastor L. Henderson Bell of the Mount Pleasant Baptist Church. And to do that, I need you to help me welcome our first guest all the way from Atlanta, Georgia. I don't know if we have him on the line yet or not. Dr. John Lipman.
Hey, thanks for having me. I appreciate you having me on your inaugural episode. That's great. Congratulations.
Well, we certainly thank you for being here, sir. I wanted to talk to our guest about some of the credentials that you have, if you don't mind me sharing for just a few minutes.
Okay.
You are a board-certified interventional radiologist and a renowned author of a non-surgical treatment of uterine fibroids. You received a master's of medical degrees from Georgetown University School of Medicine in 1985. You completed the residency in the diagnostic radiology at Brigham and Women's Hospital, Harvard Medical School, and did fellowship in vascular interventional radiology at Yale New Haven Hospital, Yale University School of Medicine. You also been awarded with a highly acclaimed fellowship status in both the American College of Radiology and Society of Interventional Radiology Society's honors that only 10% of radiologists ever achieve in their career. That's outstanding, Doc.
Thank you. Appreciate that. Yeah, it's nice to be recognized by your peers.
Yes, it is. It is. We're here to talk about a condition that I come to learn that many women suffer through, even one of my good friends, and that's fibroids.
Yes.
Can you tell me what that is? What is
Sure.
fibroids?
Yeah, fibroids are benign tumors. It's the most common pelvic tumor that is seen in women. 1 of every 3 women have these benign fibroids in their uterus, and up to 80% of African American women have these fibroids. So while it's important for all women to know about, it is particularly important for African American women to know what fibroids are.
Great. How would a woman know that she has fibroids?
Well, it's the most common reason why women have heavy periods. So if she's experiencing heavy periods, it's certainly something to ask her doctor about. Sometimes the women don't realize what heavy is. If you're changing a pad more frequently than every 3 hours, or if you need to use 2 pads at a time, or if you get episodes of passing clots or episodes where blood literally can kind of gush out or flood out, obviously that's bleeding that's way too heavy and needs to be investigated, and the most common reason are fibroids. Sometimes women can actually feel the fibroids. They're hard and firm. They're like rocks. They're made up of fibrous tissue and smooth muscle, so they're very hard to the touch. And if a woman is, relatively thin, or these fibroids may be located in the front of the uterus, which they can press on and they can feel them. They can feel these kind of hard, knot-like masses and wonder what that is. And they can cause other symptoms like pelvic pain if they press on pelvic nerves. They can cause increased urinary frequency, waking a woman up at night even to urinate because they're like a paperweight on the bladder. So there are a number of symptoms that are associated with fibroids, but the heavy bleeding, the heavy periods is the number one.
Well, really, Doc. You know, when you said getting up, going to the bathroom a lot, that I was thinking, do men get fibroids? Because we keep
No, just
running to the
women. Now,
bathroom all the
if
time.
men are getting up at night, it's probably their prostate.
Oh,
Their
okay.
prostate can enlarge, and it can cause similar urinary frequency that a woman goes through with her fibroid. So sometimes woman has the fibroids and the man has an enlarged prostate. They might pass each other in the night on the way to the bathroom. But
Right, right. Some women do they have like these heavy periods where they are afraid to go to sleep or store the linen on the bed?
Absolutely do. I mean, some of these women are just, their whole life revolves around their menstrual. They may not work a couple days a month. They may have to plan social activities around it, plan vacations. Some women don't even sleep in their own bed a couple nights because they're afraid of, as you say, the soiling clothes or linens or nightgowns, or they may sit on newspaper or sleep on plastic stuff so they don't mess up their good linens. I mean, it's a terribly disabling thing for a number of women. They have to have all this extra padding and extra gear with them. They may have extra clothing with them. It's very incapacitating and not only physically draining, but mentally draining.
Okay, so like if me and my wife are out for dinner and she has to carry extra pads or something because she might not even want to go to dinner because she might be embarrassed by the fact that this comes about, right?
Absolutely. I mean, and with all this heavy bleeding often comes anemia. And anemia just means a deficit in iron and hemoglobin. Blood has iron and hemoglobin in it, and the hemoglobin is what carries oxygen in our red cells. So when a woman is bleeding this heavily, she can't possibly replace all the iron and hemoglobin she's losing. So she becomes more tired and more weak, and it progressively gets worse and worse. So she may not be able to exercise. It's all she can do just to get through the day. So she's just, at the end of the day, just tired and weak, and it's a progressively worsening situation.
So Doc, I'm a man and I'm an alpha male, and so when I look at my woman and I see that she's not as energetic as I am, and I assume that she's being lazy or just doesn't. I might be wrong. She might be suffering from this condition.
Correct. In fact, Cynthia Bailey was a patient of mine, so I'm not saying anything out of school because she had it on, Real Housewives of Atlanta several seasons ago.
Oh, that's Cynthia Bailey.
It was interfering with her marriage. I mean, her husband didn't realize, she wasn't available for relations because when you're bleeding and gushing and, as I mentioned, you're very tired and weak, and sex is exercise, let's face it, and then also, she doesn't feel very sexual. If you're bleeding to that degree and having to wear all this extra padding and gear, and some women have to wear Depends, wearing, these like adult diapers because of the clots and all the blood, obviously you don't feel very sexual. And so all the man can kind of see is that, you're not having relations as often or at all, and what's wrong, what's going on, and I guess she doesn't love me anymore kind of thing.
Right, I was just thinking that.
Yep, and so that was what was happening to Cynthia, but fortunately, when she brought him into the consultation and we talked about what was going on, he realized that it wasn't that Cynthia didn't love him anymore, it's just she was having this horrible time with heavy periods and fibroids, and she needed to get her fibroids fixed, and once she did and had the procedure that we performed called UFE, she got her life back, as she said, and she said, I got my sexy back. So that was a good thing.
Great. Hey, you know what, Doc, let me take a minute for just a second. For those of you out there who have questions or want to make comments or anything, why don't you go to my Facebook page. It's Back on Track with Wardel. And there's a button there that you can actually join our group conversation. And if you have any questions or anything that you want to ask Dr. Lipman, we will send those to him, and he is committed to answering all of the questions that you have. And also, you can go to his website, atlii.com, and you can reach him there. And he likes you to follow him on Instagram at dr-lipman. That's his last name. We will give this information out as we go further into this interview. But Doc, I'm understanding that this not only affects women, but it also affects the men or in their relationships, especially the sex part. So,
correct.
Is there hope? Is there a procedure out there that works to kind of help get us through this?
Sure does. And to say, we've been performing this procedure called Uterine Fibroid Embolization, UFE. I've been performing it here in Atlanta over 20 years. And it's one of the biggest medical breakthroughs for women. But the biggest issue is that most women, even today, that are suffering with fibroids never hear about it because the gynecologists aren't trained in it. They don't perform UFE. They're surgeons. That's what their training is surgery. And surgeons obviously like to operate and will, in a lot of instances, women will only hear the surgical option. They won't hear about UFE. And so it's the procedure, just to kind of discuss it a little bit, UFE is completely outpatient and non-surgical. So there's no cutting on the woman at all. We do everything from the inside. Under X-ray guidance, I can pass a little tiny catheter through a little nick in the skin. Where a woman can feel her pulse at the top of her right leg, we go in and negotiate this little tiny catheter like a piece of spaghetti. Under X-ray, I can get into each uterine artery separately. Wow. Each uterine artery branches like a tree, getting smaller and smaller branches till you get out to the leaves of the tree. The leaves are the fibroids. And I know what size those tiny branches are, and I can flow direct these tiny particles to plug up all the fibroid branches. So the uterus, the big trunk and the main branches, the uterus stays alive, but all the fibroids do not. And as they die, they soften and shrink, and a woman's symptoms disappear by the time I see them in follow-up 3 months later.
Wow.
So the procedure takes me about 30 to 45 minutes. As soon as I'm finished, I pull the little piece of spaghetti out, put a Band-Aid where we went in. So she gets a Band-Aid, no surgery, gets to keep all of her parts. She gets the relief of symptoms. She avoids all the risks of being cut open surgically, all the long recovery, because the recovery from a hysterectomy can be 2 months or more. The recovery for UFE is 5 to 7 days.
Wow. So the traditional procedure has been hysterectomy. Is that correct?
Correct. Hysterectomy is the most common reason why, or fibroids is the most common reason why women undergo hysterectomy, which is kind of surprising because, why are we doing something so drastic for a benign tumor?
Wow.
Hysterectomy is the second most common surgery performed in the United States. And
Wow.
That's kind of surprising because both of us aren't eligible, and half the population in the United States, men, aren't eligible, and yet it's the second most common reason why women get second most common surgery, and then the most common reason is fibroids, and the average age of hysterectomy is less than 40. So these are young women that are getting hysterectomies. In fact, I speak all over the country on fibroids. I was at Tuskegee University recently and met 2 women less than 30 that had already had a hysterectomy. They didn't want it, but they were devastated to find out they could have had UFE instead and kept their parts, and even had children afterwards, potentially, because if you have your uterus, I've had a number of women have children after UFE, even 3 sets of twins.
So, Doc, let me ask you something. I'm hearing this. Is this something on the lines of the Tuskegee experiment that they did back in the, 30s or 40s on the men?
Yeah, the Tuskegee experiment was a very dark day for medicine. It was started back in the early 1930s. It was basically a group of very poor Alabama sharecroppers, men who had contracted syphilis and were very poor, agreed to be studied because they didn't have really any kind of answer for syphilis back in the early 30s. This was before antibiotics came along. And so they agreed to be part of this study that would follow them and see how they did, kind of the natural history of syphilis, if you will. And they agreed to volunteer for this, and they would get free medical care and a free lunch. And so they did it. They were poor, and during that time, it started in the early 30s, but in the 40s, penicillin got discovered and came on the market during the Second World War. And the problem was they didn't tell these guys that.
Wow.
They let them continue to suffer, and syphilis, advanced syphilis, is truly suffering when it involves the spine and the brain, and I mean, it's miserable. It's absolutely horrifying that they let this go on, and it eventually came to light, and it stopped in the early 70s, so it was 40 years before finally this treatment of these guys stopped. And how it stopped was a number of them enlisted, and the Army said, well, wait a minute, you've got syphilis, how come you didn't get penicillin? And, what's penicillin? I mean, so that's when everything kind of unraveled, and the result of the Tuskegee experiment was that anybody that would volunteer for any kind of experimentation or research trial, or anyone that would have any medical procedure, would have to sign a piece of paper saying, the physician involved explained to me all the risks and benefits of all the different options, and I'm choosing this particular option, and I'm signing off on it. So that's called informed consent. A patient is now going to be informed of all their options, and they're going to consent to the one they signed on the dotted line for.
Wow.
And as you mentioned, this is a little eerily somewhat similar in the fact that women are not being told of all their options like was promised from the Tuskegee experiment. It was promised that you are now going to have informed consent and that will take care of it. Because for the most part, they're not being told of all their options. They're only being told some of their options. So while it's not exactly, there's enough of a parallel here to be concerned and raise some important questions about this.
So, Doc, this sounds like don't want to sound like a conspiracy theorist, but it sounds like an attack upon the family when you take the U. I probably want to start something like don't let them take your U. Do you have a campaign like that going on?
Well, we exactly have that campaign.
Oh my goodness!
And it's called "Don't Lose Your Why." Don't lose your U. Don't lose you are you. Because when you lose your U, your uterus, you often lose your YOU. What makes you is your uterus. It's the epicenter of a woman. And when you have a hysterectomy, it has consequences for women. It's not just simply, take it out and be done with it, and it won't affect you in any way. It affects women profoundly. It affects them psychologically. Women that have a hysterectomy often are affected psychologically. They don't feel as much of a woman, kind of like a man being castrated. There are a number of women that are affected sexually, loss of libido, loss of orgasm. So that's something that's, again, usually not discussed, and a woman is kind of thrust into it. In fact, this 26-year-old woman who had already had a hysterectomy at Tuskegee that I met she said, I feel like I'm an old woman. I just don't feel like engaging in sexual relations with my boyfriend. I feel tired and old and just not interested in these things. And it's really, she was devastated.
Wow.
And so it just doesn't have to be. We don't have to do any hysterectomies for fibroids. They're completely unnecessary. You can keep your U, get the relief of symptoms from fibroids, which are often, as we mentioned, significant. Avoid the risks of surgery, because there's lots of surgical risks, and the long recovery, and keep all of your parts.
Wow. Can men enjoy? When you said something about being castrated, that really brought this whole situation to light to me. I certainly don't want to be castrated. And if you
Sure.
take that, you destroy the family, and then you eventually will destroy the relationship.
It can affect women that significantly. I mean, some women will tell you they didn't mind their hysterectomy, but that's that's a minority of patients. If you really talk to their family members and ask them about, you'll often hear that the woman wasn't the same again. She behaved differently. She looked at life differently. Obviously, the relations, the partners that she was with, it affected that. It's just, the bottom line is it's unnecessary. You don't have to undergo this, surgical procedure, this hysterectomy. You don't need it. This UFE procedure, which is proven safe and effective over many years, I say I've been doing it over almost 25 years now, will give the woman the relief of symptoms. She avoids surgery, goes home the same day, not only with her uterus, but just a Band-Aid, a brief recovery at home of about 5 to 7 days, and she's good. She keeps all of her parts.
That's fantastic. All right, I hope you guys got your pens and papers. Write this down. If you want to join our conversation, go to my Facebook page, Back on Stage with Wardel, and join our group. If you need to give us a call at 877-556-6546, and we'll be happy to give you any direction or answer any question that we can, but we actually prefer you to talk to Dr. Lipman also. And you can go to reach him through his website at atlii.com, or follow him on Instagram. He really loves you to do that. Isn't that right, Doc?
Yeah, it is, and it's Doctor, so DR, and then underscore my last name. So it's DR_LIPMAN.
Yes. And just let's have this movie, because I would like to, for my significant other, if I was young couple, I would want to have every opportunity to have my family. And briefly, just talking to the business that I'm into protecting the family, protecting the income, and in order to have a healthy mind, healthy body, you also need to be healthy in order to get something like a life insurance policy. So I do health insurance also, and we particularly talk about Medicare and other things that we do. So give us a call at 877-556-6546 if you need to, if we can help you. We want to protect our families and help them grow. They make a strong community. Do you agree, Doc?
Absolutely do. And what's really important is, even in my household, I have 3 children, and I'm a physician, obviously, but even in my household, my wife is the one that's responsible for all the health and the health care of the family. So when Mama's not feeling well, it affects not only her, but the entire family. And women tend to kind of take this, they're nurturers. They tend to take care of everyone but themselves. And so it is particularly important for women, to get the help they need and be healthy, because they're responsible for way more than just themselves.
Well, yes, they are. And the old saying, if his mama not happy, nobody's happy, right?
Absolutely.
Yes. Why are African American women affected by fibroids more than other women?
Well, it's 2 reasons. One, first, no one knows where fibroids come from. I wish we did. But once they arrive, they grow with hormones, particularly estrogen. And so that's why they can grow really rapidly during pregnancy, and why they tend not to be an issue once a woman hits menopause. Estrogen is stored in fat and produced in fat. So the more body fat a woman has on her, the more stimulated her fibroids become. And so one of the reasons why African American women disproportionately suffer with fibroids over other racial groups has to do with, in general, they have more body fat than other racial groups. If you look at body fat distribution by race, African American number 1, Asian the lowest, and that's also true with fibroid the prevalence of fibroids. But it's not the entire story by any means. There is a strong genetic component that runs stronger in African American families, but we can't really do anything about the genetic stuff. We can't pick our parents. But we can try to be as close to our ideal body weight as we can by losing any excess body fat. So we kind of try to implement from the get-go a anti-estrogenic approach, an anti-estrogen strategy to try to, curtail estrogen. And some of the ways to do that is get the woman in an exercise program so that she will be closer to her ideal body weight. There are certain foods that are kind of hormone-rich, if you will, and that includes red meat, chicken, and dairy. So we can modify some of those things if they can substitute, say, almond milk for cow milk, or they can do free-range chicken rather than these hormonally plumped-up activated chickens. These things will help. There are certain colored fruits and vegetables that have what are called flavonoids in them. And so while your mom growing up always wanted you to eat the vegetables, one of the reasons is these flavonoids block estrogen. So just another reason to eat colored fruits and vegetables to try to lose excess body fat. It's going to be good for your overall health, your cardiovascular health. It'll also be good for your fibroid health.
Well, that sounds good. Well, Doc, we're running out of time. We're coming to the end of the show. And so people I want to thank, I want to mention my partner that sings with me, Fred Winchester. I know he's out there listening to you. Hey, what's up, man? And I want to thank Kim Johnson for working so hard on our website, Back on Track with Wardel.com. Our number is 877-556-6546. There you can get all the important information you need to get for a healthy mind, a healthy body, and a healthy soul. Next week, we will have Dr. Lang, and we're going to talk about the effects of domestic violence.
Yeah, the website is atlii.com, or if they want to call the office directly, that's area code 770-953-2600, 770-953-2600. Be happy to talk to them. And the website, again, is atlii.com.
atlii.com. I'm looking at our producer, and I'm not sure if I have any more time, but if we don't, I say goodbye, thank you, and see you next week, Monday at 10 a.m.
You've been listening to Back on Track with your host, Wardel Williams. Tune in every Monday at this same time on Gospel 1590. For more information or to request a topic, 816-721-5378. Back on Track with Wardel Williams, your home for a healthy mind, healthy body, and healthy soul.